Welcome to the deep dive. Today we're looking closely at some specific source material. It's excerpts from a veterinary text on ovarian tumors in dogs and cats.
Right.
They're quite rare apparently, but well, obviously significant if they happen.
Definitely.
So our mission here is to really unpack this material, figure out the crucial bits, and understand what this specific text tells us about them, kind of cutting through the dense medical info to get you the essential facts.
Exactly. We'll dig into what these tumors are, which pets might be more likely to get them, how vets approach diagnosis based on this text, the treatments discussed, and, the outlook.
It's pretty specific stuff, yeah.
It is, but it's packed with important details for understanding, well, potential issues for our female pets.
Okay, let's dive in then. The text talks about ovarian tumors in dogs and cats.
Yeah.
What are the main categories it lays out?
So the source breaks them down into three main types. First, you've got epithelial tumors, often carcinomas.
Okay.
Then there are germ cell tumors, things like dysgerminomas, teratomas. And the third group is sex cord stromal tumors. That's a bit broader, covers granulosa cell tumors, Sertoli-Leydig cell tumors, the comas, luteomas. Quite a few there.
So different origins within the ovary itself.
Exactly. Different cell types leading to different tumor families.
And overall, how common are we talking? You said rare, but...
Yeah, the text really emphasizes that. For dogs, it's a small fraction, somewhere between, say, 0.5% and maybe 1.2% of all reported tumors.
Wow, tiny.
Pretty tiny. In cats, it's a little higher, but still low, maybe 0.7% up to around 3.6% of tumors. So yeah, definitely not common, but they do happen.
Good to have those numbers for context.
Yeah.
And that mix of types, you mentioned epithelial, germ cell, sex cord. Is it the same breakdown for dogs and cats in this source?
No, and that's actually a really interesting point the text makes. In dogs, it's more spread out. About 40% are carcinomas, maybe 10% germ cell, and the biggest chunk, around 50%, are those sex cord stromal ones.
Okay, half are sex cord in dogs.
Right, but cats, very different picture according to this text.
Mm-hmm.
Only about 15% germ cell, and a huge majority, like 85%, are sex cord stromal tumors.
85%.
Yeah, so the kind of ovarian tumor is much more likely to be sex cord stromal if you're looking at a cat based on this source. Big difference.
That's a really key difference. Okay, now the scary part with any tumor spreading, metastasis. What does this text say about that?
Yeah, this is where the significance really hits home. The text states metastasis is common.
Common, full stop.
Well, for dogs, it says it's common specifically for the malignant epithelial and germ cell types.
Okay, the malignant ones. Makes sense.
But get this for cats. The text states metastasis is common for all types of ovarian tumors listed.
Wait, all types? Even the ones that might be benign otherwise?
That's what the source indicates, common for all types in cats. It's a really critical distinction.
Wow, that definitely changes the outlook depending on the species.
Yeah.
You also touched on some being functional producing hormones. Tell me more about that.
Right, that's another fascinating angle in the text. Some of these tumors, particularly certain sex cord stromal ones like granulosa cell tumors, can pump out hormones, estrogen, sometimes progesterone.
And what does that do?
Well, it can cause effects all over the body, far away from the ovary. They call these paraneoplastic syndromes. So the tumor isn't just a lump. Its hormone production can cause systemic problems.
Okay, that makes sense of some potentially weird symptoms then.
Yeah.
So who gets these? Does the text point to risk factors, breeds, age?
It does. Typically, it says middle-aged to older animals are affected, although it notes one specific type. Teratomas, those are germ cell tumors, can sometimes pop up in younger animals.
Okay, mostly older, but exceptions exist.
Exactly. The biggest risk factor highlighted in the text, though, is being intact, not spayed.
Right. Intact sexual status. That seems logical.
And for dogs, it actually lists specific breeds that seem to be at higher risk, according to this source. Pointer, English Bulldog, Boxer, German Shepherd, and Yorkshire Terrier.
Interesting. So being intact is a major factor and maybe some genetic predisposition in those breeds.
Seems like it, based on this text.
So given the hormones, the potential spread,
Yeah.
what signs might an owner actually notice? What makes a vet even think of this?
Well, the text mentions several possibilities. Some are linked directly to those hormone-producing tumors, things like bilaterally symmetrical alopecia, that's hair loss in a matching pattern on both sides of the body.
Okay, symmetrical hair loss.
Or it can even cause pancytopenia, a drop in all blood cell types. Red cells, white cells, platelets. That's serious.
Yeah, pancytopenia sounds really bad.
It is. And sometimes the hormone imbalances can even lead to masculinization signs.
Masculinization. In a female dog or cat?
Yeah, it can happen with certain hormone shifts caused by the tumor.
Okay. What about signs not tied to hormones? Just the tumor itself?
You might see malignant ascites, that's fluid buildup in the abdomen, or sometimes pleural effusion, fluid around the lung.
Fluid buildup. Okay.
And then there are just general signs from the mass itself, taking up space, pressing on organs. The text calls these mass effects, maybe vague signs like lethargy or poor appetite if it's large enough.
Right. So if a vet sees some of these signs or maybe feels a mass during an exam, how does the diagnostic journey usually go, according to the source?
Well, the first step is usually thinking about other things that could cause similar signs. The differential diagnosis list.
Ruling things out.
Exactly. The text mentions ruling out other causes of abdominal fluid, maybe vasculitis, which is blood vessel inflammation, or pancreatitis. Also considering other kinds of masses in that area, or even non-cancerous ovarian things like cysts or vascular hematomas like blood clots.
Makes sense. What about basic blood work? CBC chemistry, does that usually point straight to it?
Often not, according to the text. Those routine tests frequently don't show consistent abnormalities. The big exception, though, is that pancytopenia we mentioned that might show up on a CBC in dogs if they have one of those functional hormone-producing tumors.
So blood work might be normal, or it might show that severe pancytopenia.
Pretty much.
Are there specific hormone tests mentioned?
Yes. The text notes measuring serum progesterone. If the level is over 2 milligml, that's pointed out as a potential clue for a functional tumor.
Okay, progesterone levels. What about looking inside? Imaging must be key.
Oh, absolutely. Abdominal X-rays radiography might show a mass. Could be one ovary, could be both. Often found near the back end, the caudal pole of the kidney. Sometimes you see fluid, maybe even bits of mineralization in the tumor on the X-ray.
So X-rays give you a first look?
Right. Then abdominal ultrasound usually follows. That gives a much better look at the mass, helps confirm it's likely ovarian in origin, shows the internal structure a bit.
Ultrasound for more detail. And if they need even more detail, like, is it stuck to anything?
That's where advanced imaging comes in CT or MRI. The text says these are useful for really assessing the origin and seeing if it's invading nearby tissues. And crucially, given the high risk of spread we talked about, the text emphasizes getting thoracic radiographs, chest X-rays. You have to check the lungs for metastasis.
Right, checking for spread is vital. So imaging finds it, checks for spread.
Yeah.
How do they get the definitive answer? What kind of tumor is it? Can they just, poke it with a needle? FNA.
So the text mentions diagnostic procedures. If there is fluid ascites or pleural effusion, checking that fluid under a microscope, cytology can sometimes diagnose a malignant effusion.
Okay, fluid analysis can help.
But, and this is a really important warning, in the text, fine needle aspiration directly from the mass itself is often discouraged.
Discouraged. Why not? Isn't that standard for lumps?
Because the text warns these ovarian tumor cells can apparently implant really easily along the needle track in the body wall.
Oh, so the biopsy itself could spread it.
That's the risk highlighted in the source, seeding the tumor cells during the FNA attempt.
Yikes. Okay, so if FNA is risky, how do they get the final diagnosis?
The text implies that the gold standard is surgical removal, taking the mass out, and then sending the whole thing or sections of it for histopathology. That's looking at the tissue architecture under the microscope. That gives the definitive type without the risk of seeding from an FNA.
Right, surgery followed by histo. That makes sense to avoid spreading it. So, okay, diagnosis is confirmed. What does the source say about treatment?
For a solitary mass, assuming it hasn't obviously spread everywhere, the text presents ovariohysterectomy, basically, spaying as the treatment of choice. Remove the ovaries and uterus?
The standard spay, essentially, but as treatment.
Pretty much. And it even adds a practical note about being careful during surgery, the potential for peritoneal transplantation, meaning accidentally spreading cells within the abdomen. It recommends changing gloves and instruments during the procedure to minimize that risk.
Wow, that detail about changing gloves really underscores how worried they are about spread, even during surgery.
It does.
What about chemo? Is that common?
This is where the information gets thin, according to the text. It explicitly states there's little info available and no standard chemotherapy protocol for these tumors in dogs and cats.
No standard chemo. Okay.
It does, however, mention a few specific drugs that have reportedly had some success in, really limited cases that were written up.
Which drugs were those?
Let's see, cyclophosphamide, chlorambucil, lomustine, and bleomycin were mentioned together as having reported success in one dog. And then cisplatin was mentioned for 3 dogs where success was reported.
Just a handful of cases noted.
Very limited data, yeah.
Are there warnings about those drugs? Chemo usually comes with risks.
Oh, yes, very significant ones, especially for cisplatin. The text stresses it should absolutely not be used in dogs with kidney problems.
Right.
Or without making sure they have appropriate concurrent diuresis, basically flushing the kidneys with fluids to handle the drug.
Okay, kidney safety is crucial for cisplatin in dogs.
Hugely. And the biggest warning, the text flat out states cisplatin is fatal in cat.
Fatal in cats, full stop.
That's what it says. And then there's a general caution that all chemotherapy drugs can be toxic and really need to be handled by someone with expertise.
Those are serious warnings, especially the cisplatin one for cats. Okay. Given the spread potential, the limited chemo info, what's the overall outlook? The prognosis?
The text sums it up pretty bluntly. The prognosis is generally guarded.
Guarded. Not great, not hopeless, but worrying.
Yeah, that's the sense you get. Guarded.
Does the text mention anything about prevention?
It does. It lists ovariohysterectomy spaying as a method of prevention.
Which ties right back to intact status being the big risk factor. Makes perfect sense.
Exactly.
What about follow-up after treatment? What does the source recommend?
Regular monitoring. It suggests abdominal and thoracic x-rays, belly and chest every 3 months.
Every 3 months. Why so often?
To check for recurrence, the tumor coming back locally, or for metastasis, spread showing up later, especially in the lungs.
Vigilant monitoring. Okay.
Yeah.
And does chemo, even though it's not standard, offer any hope for improving that guarded prognosis?
The text does note that, despite the limited data, chemotherapy does have the potential to lengthen survival time. So maybe buy some time, potentially.
Okay, potential benefit, but still guarded overall. One last thing does the source mention. If these tumors often show up alongside other problems in the reproductive tract.
Yeah, it lists a few associated conditions, things like pyometra, that's a nasty uterine infection.
Right.
Also ovarian cysts, cystic endometrial hyperplasia, which is thickening of the uterine lining, and ovarian remnant syndrome, where maybe a bit of ovary got left behind after a previous spay.
So these things can sometimes occur together.
Apparently so, yes.
Okay. Well, this deep dive into the source material has really laid out the key points on ovarian tumors in dogs and cats. The types, how rare they are, the really important signs, especially the hormone-related ones, the diagnostic steps, those crucial warnings like about FNA.
Right, and the treatment focusing on surgery, the limited chemo options, and that guarded prognosis.
Understanding all this seems vital, especially knowing how commonly they can spread, according to this text, and the specifics around diagnosis and treatment warnings.
Absolutely. Knowing the risks, the signs, the path vets take based on this kind of information, it's really valuable knowledge for anyone with female pets, even if these tumors are rare.
Definitely. And thinking about everything the source presented, it leaves you with a couple of interesting thoughts, doesn't it? I mean, look how clearly the text connects being intact as a risk factor directly to spaying being the prevention.
It really hammers home that preventative aspect of the surgery.
And that mention of specific breeds, the pointer, bulldog, boxer, German shepherd, Yorkie, doesn't that just scream potential genetic factors at play?
It certainly makes you wonder, yeah. How much is inherited predisposition versus other factors?
Exactly. So this information from the source, while focused on the clinical side, definitely opens up those bigger questions about prevention, risk, and maybe even genetics when it comes to these specific rare tumors. Lots to think about.